My name is Dr. Adam Farber, and I would like to talk to you today about injuries to the acromioclavicular, or AC joint. To understand AC joint injuries, you must first understand normal shoulder anatomy. The shoulder is a ball and socket joint where the socket, also known as the glenoid, is part of the shoulder blade, and the ball, also known as the humeral head, is part of the upper arm bone. The ball and socket joint is enclosed within the red circle in this image. In addition to the ball and socket joint, there is another joint in the shoulder complex. A portion of the shoulder blade known as the acromion connects to the end of the collarbone, also known as the clavicle. The area where the acromion and clavicle meet is called the acromioclavicular joint. It is enclosed within the green circle in this image. This slide shows a close-up view of the acromioclavicular, or AC joint. The acromioclavicular joint, shown within the red circle, includes the acromion, a portion of the shoulder blade, and the collarbone, or clavicle. This slide also depicts another portion of the shoulder blade known as the coracoid process. This bony prominence, enclosed in the green circle, serves as the attachment site for some of the ligaments that help stabilize the AC joint. This slide shows a close-up view of the ligaments that stabilize the AC joint. The acromioclavicular ligament extends from the acromion to the clavicle and is enclosed in the red lines in this image. In addition, there are two coracoclavicular ligaments that extend from the coracoid process of the shoulder blade to the undersurface of the collarbone or clavicle. These ligaments are enclosed within the green lines in this image. AC joint injuries are commonly known as shoulder separations. Injuries to the AC joint may occur as a direct contact to the collarbone, or after an injury in which the patient falls directly on their shoulder, as shown in the image on the right. Injuries to the AC joint may also occur if the patient falls and lands on a flexed elbow, as shown in the image on the right in this slide. Patients who sustain injuries that affect the AC joint typically report pain in this region on top of the shoulder, as shown in the image on the right. Depending upon the severity of the injury, some patients may also notice a deformity of the collarbone which appears to be prominent. The image on the right in this slide shows a prominent clavicle in a patient with an AC joint separation. AC joint injuries are classified based upon the direction of displacement of the collarbone and the extensive injury to the acromioclavicular and coracoclavicular ligaments and overlying musculature that help stabilize the AC joint. There are 6 different types of AC joint injuries described. These are all shown in the image below, but I'll review them individually in the following slides. The classification is important to understand because the classification will help determine the appropriate treatment. A type 1 AC joint injury involves a mild sprain of the acromioclavicular ligament enclosed within the red circle, but the ligament is not torn. Furthermore, the coracoclavicular ligaments are not injured. A type 2 injury involves a tear of the acromioclavicular ligament enclosed within the red circle, but the coracoclavicular ligaments are not injured. A type 3 AC joint injury involves a tear of both the acromioclavicular ligament enclosed in the red circle and the coracoclavicular ligaments enclosed within the green circle. In this injury, the collarbone is usually displaced upwards and a deformity is visible. A type 4 AC joint injury also involves a tear of both the acromioclavicular ligament and the coracoclavicular ligaments. In this injury, the collarbone is displaced backwards, not upwards as in a type 3 injury. This injury is exceedingly rare. A type 5 AC joint injury involves a tear of both the acromioclavicular ligament and the coracoclavicular ligaments. In addition, the muscle layer overlying the collarbone is disrupted. As a result, the clavicle is displaced upwards in a more prominent fashion, thus distinguishing this from a type 3 injury. A type 6 AC joint injury involves a tear of both the acromioclavicular ligament and the coracoclavicular ligaments. In this injury, the collarbone is displaced downwards underneath the coracoid, not upwards as in a type 3 injury. This injury is also exceedingly rare. Conservative, non-surgical treatment is recommended for all type 1 and type 2 injuries and the vast majority of type 3 injuries. Conservative treatment for AC joint injuries consists of a period of rest, icing, routine anti-inflammatory medications, the use of a sling as needed for comfort, and formal physical therapy. Surgical treatment is recommended for type 4, type 5, and type 6 AC joint injuries. Some patients, such as overhead athletes or heavy laborers with type 3 injuries, are also recommended to undergo surgery. In addition, patients with type 3 injuries that fail to improve with non-operative treatment may require surgery 3 to 4 months after the initial injury. For further information about AC joint injuries, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com. Thank you.